thank you so much for joining us on the program Delta State Contributory Health Scheme and you. I am your host, Eunice Emeyazia. Well, today we're looking at a very important topic and we're talking about 100,000 enrollees. I know in your mind you'll be wondering which one is 100,000 enrollees. Well, that you get to know more about that. Talking with me today is the Functioning Director General of the Delta State Contributory Health Commission, Dr. Alfred Ebiakofa. Welcome, sir.
Thank you very much, and good afternoon, viewers.
And then you can see Patricia Memodu is already standing by. She's right here. She's going to be talking about it with me today. Welcome.
Thank you so much, my people. Now go. Now good evening. No, you don't come again as you come every week.
Okay, so we're looking at 100,000 enrollees, and I just wanted to start up immediately. What is the concept behind the 100,000 enrollees?
Yeah, the 100,000 enrollee is just to pick a scratch from the number of vulnerable people we have in the state. As we speak in the Social Protection Register, we have about 600,000 on that list. It comes to us that, okay, if the governor is going to celebrate his 100 days in office very soon, let's call on people to see. To mark that day, let's see if we can register 100,000 people. Take 100,000 people out of medical hardship. Take 100,000 people to come into the health insurance scheme and enjoy the benefits of good health without having to pay from their pockets.
That's actually one of the things that I have been thinking about. You know, when you talk about 100,000 enrollees, I was like, is it achievable? 100,000. But like we'll get to find out the strategies that you are going to put in place, or you have already put in place to actualize this. But let us open the lines. Patricia Memudu, you want to call out those lines for them?
Yeah, the number one I will take pictures now 0906 273 9107. Make I take them again. 0906 273 9103. Now this number now will take call us. Make una ask questions or contribute as they picture now, and as I want take learn too.
Okay, so just endeavor to call us. We have less than 30 minutes for this particular episode. So you do well to call us. Let us know what you think, what you have been experiencing with the scheme, if you have been in the scheme. And also, if you have not been in the scheme and there are questions that are bogging your mind, this is the right time. We have Dr. Alfred Ebiakofa, who is going to be telling us so much about this. Remember the number to call, 0906 273 9107. All right, sir. Dr. Alfred Ebiakofa, please tell us what are the strategies you have put in place to ensure you have this 100,000 enrollees?
Yeah, in the states, like the states, Delta and they carry last. We have a good number of people to whom 700,000 may mean nothing. So we are appealing to those people. If 1,000 of them register 100 persons, we have 100,000. Already have some people that have volunteered. They said they'll pick up 1,000, because to give 1,000 people health care for 1 year, it's just 7 million.
Wow.
1,000 people for 1 year, just 7 million. And those 1,000 people will enjoy healthcare. And I'm sure that there are people that can afford that without blinking their eyes. So we are calling on those people. This 100,000 is not people that can pay from their pocket. We want people to help us reach out to the poor of the poor. That don't worry, we've got you covered. That we know you are there, and we are trying to we are reaching out to them that they belong to the society and the society cares.
Wow. So that means it is really, really achievable. I know that there's something in your mind that you have.
Yeah, it's achievable as my Oga don't talk. Because this 100,000 as he take talk, he even go far for 1,000. If you want to register 100 persons, when we say don't take 100 persons for 1 year, see, don't take care of them. Now 700,000 naira. And you know wetin 700,000 naira mean to some people like us, when we say we dey village, say we no get this money, na big money, but we know say we get our brothers, our sisters, the well-meaning deltas, when we say can easily bring out this 700,000 naira to register 100 persons. So if each person take that one, in my local government chairman take, other people, House of Assembly members take, register people like my oga talk, people when we dey talk, na people wey no go fit bring out this money. Instead, when we say every day they go to come knock for your domot, come, I wan go hospital, my pikin dey sick or this one, take 7,000 naira, go register them. For 1 year, nobody will come knock for your door say e dey sick, because and dem go dey pray for you. Because anytime when dem feel sick, dem go hospital, go take care of themselves. Now so it's achievable. To achieve am dey very, very easy. Now say whether I wan do am, you go do am.
Okay, so if somebody is interested in doing this, who is now responsible for selecting the beneficiaries? Who does that? Is it the commission? Is it the sponsor? How do you go about that?
No. He who pays the piper dictates the tune. That's what the dictum says. But yes, the person who is paying for, who is sponsoring, who select the people. But what we are saying is, please, don't select people that can afford it. Select people that cannot afford it. Even the Bible says, whatever you do to the least of my brethren, so that's what you've done to me. So we're asking you to pick the least, those that cannot afford it. The old ones, the widows, the people living with disability who do not have any form of source of income, but they are living with you in those communities. Those are the people we hope that they will select. But we are not holding anybody. If you pay, you give us your list, tell us these are the people you want to register, and we will go register those people.
Wow. Okay, the number again that you can call is 0906-273-9107 for those who are really interested in helping people around them. I know I was asking you this question. I think I should bring it up because there are a lot of persons who have so many ideas on what to do about this. Like somebody who wants to celebrate birthday with the needy and all of that. They can actually pick something like this, right, sir?
Yeah, very well. You can even pick, maybe, some people celebrate their birthday and they go to orphanages and drop rice and all those things. You can do that. You can go to the orphanage and pick children and register them. You can go to communities. We have IDP camps all over the places. You can go to communities, pick from among the poor of the poor, and then register them. And there's nothing that says if you have a birthday and there are some celebrities that can call their friends, today is my birthday, I want to give 1 million people free health. Donate to my account so that we can give it. It can be done.
Wow.
So anyhow, what we want is that this less privilege, this poor among the poor in our societies should have health succor, should benefit, should feel the impact of the more agenda. That's what we are saying.
Is there a time lag? I know you said something about celebrating the 100 days in office of the governor. So after that is over?
No. This 100,000, like I said before, we have in the social register, we have about 600,000 people that will need this service, that will need this help. So this 100,000, we're just saying it to mark the governor's 100 days in office. But after this state continues, because you have these people living with us. They need this help. They need this assistance. So instead of waiting till the person comes to knock, let me give you an instance. To treat, most time people go to hospital, they tell you have malaria and typhoid. To treat one stance of malaria, one episode of malaria and typhoid will cost somebody between 35 and 50,000 naira. But that amount is avoided if you register in the scheme with just 7,000 naira. And there are people who have this episode like month in, month out, like that.
You're always in the hospital.
They're always in the hospital because of malaria. They're always in the hospital because of cough, all this stuff. With 7,000 naira, you can say, go to the hospital. If the person call you, I register you, go to the hospital. So that is a relief even for you that is helping to pay, because it's going to save you a lot of inconveniences, because somebody comes to meet you and says, look, my child is in the hospital, and maybe at that point in time you don't have cash and you give the person 5,000. 5,000 is not enough to
out of pocket expenses.
And the person, that 5,000 cannot even help the person. And so when you have it now, register the person for 1 year for just 7,000 naira. Like a friend of mine says, just miss 2 bottles, forget about taking pepper soup and 2-3 bottles of beer for 2 nights, and you will have 7,000 naira to help somebody pay.
Yeah. Okay, I was wondering, this initiative, how did you even conceive it? I mean, what informed this idea? Because to me, it's a very laudable idea. How did you just, sit and think about this idea?
Well, when I came in, I was discussing with some people, and they said, first somebody told me, your program is cheap, the 7,000 is okay. He said, but even that 7,000 is difficult for some persons to pay. At that point, every government wants to celebrate things around them. We were like a PPP arrangement, because private funds come in and this and so. And it just occurred to me, the governor is going to mark 100 days very soon. So if we take 100 persons per day from 1,000 people, we would have achieved the 100,000. That was what we then said, okay, let's do this. And my PR group says, yes, it's achievable, let's see, let's run with it. And that's how we started the 100,000 to mark the 100 days of our governor in office.
I know that our pidgin English woman has been, itching to say 1 or 2 things. Please tell us those things that...
Yes, like my Oga don talk. Say, you and I know. See, for 100 days now, see, governors, they celebrate and they won't celebrate what they not achieve for 100 days in office. And friends and well-wishers go home, help them, celebrate them, go to pages of newspapers, media houses to put money and all those things. We are not saying, well, if I talk that one, I go say whether I want come more food for your mouth. We not say make them no come advertise, make them no come celebrate them. But out of that 500 and something thousand naira, go pay for pages of newspaper. Bring out money, register some people for health. Say I dey use this to celebrate 100 days in office for our Oga governor. When don't talk say, say our government don't talk say could go reach everybody. That's so we take put out. So we don't feel say before we go even enjoy this benefit when government don't package for us, we need to stay healthy. So follow, just help that money. Now small money but na big money. So if you bring them, they register these people. You don't comot a whole lot of problem for person body. So now all those things bring the idea, and so that some people no go say they know they are aware. Now make we bring them, carry and come there dormant. They knock, they sensitize, or tell everybody, say see the programs when we get. So all the governors' friends, all the Delta State friends, all our friends, our people well meaning Nigeria, now then we they call, say may they help. Register all these people when they don't more. Like my Oga talk, no be we go impose people when you go register for. Now those when we say you they help take people when they your constituency, people when they your environment, when they your local government, when they your community, when they your village, when that person, that house when near your house, now them will just speak. And if any, because we know say for every community we get big man, we get big woman. So if me from my own community I pick, you from your own community you pick, before you know it we go touch every community. And this our Delta State will dey healthy. Now wetin we dey do.
So like a multiplying effect. Well, we'll talk about the multiplying effect, but let's look at anyone that wants to key in, because someone like me, if I'm just hearing this for the first time, it will click my interest. I'm like, oh, let me do this. 7,000 naira is not that much for me to help one person. So if it's one person, if it's two persons, if 500 persons, if it's 1,000 persons, depending on your capability. So now I want to key in. How do I go about it, sir?
Well, for those who live around Asaba and environs, we have our office at number 10 DBS Road. We have a registration center there. But then we also have liaison offices all in every local government area. Aside that, we have agents in every primary healthcare center and government hospitals. So you can walk into any of them, ask for the Delta State Contributory Health Commission agent, and he will give you the information you need to register for this group of persons. And if you say you are one of those people that will need to publish your name for doing such a fantastic job, you can reach us at our headquarters. Should give us the names of people you want, and then at the time we are doing the roll call of those who have stood by us to achieve this program, your name will be mentioned.
So when the roll is called up, your name will be there.
Yeah, your name will be there.
Okay, so let's look at the multiplying effect on the society.
To join for that one, like say you can cluster.
Yes.
You understand what I mean? Be say I dey Oshini North local government. I won't register 50 or 100 persons, and you can bring them together for one any place where you choose. All of them come there. Our agents and we carry all our instruments and equipment. Come meet them there. Register all of them.
Like bring all the people you want to register.
People you want to register.
Okay.
Bring them together.
Okay.
We get manpower. People will go come, go meet you now there. So you no need to stress yourself to say, we dey come as about, we dey come here. Just tell us say you dey ready, get their names ready, get them together, then we go carry every of our team, go there, go register all of them.
Wow.
Like just what you said now, you know, sometimes you have these town hall meetings kind of. You can call your people together in one hall and tell them, maybe you are giving them additional palliative, and say, okay, I want to also register these people. Just give us the information and we'll be there to do the registration and ensure that these people get to hospital and anytime they need the services in no distance time.
All right, let's look at the multiplying effect of this project that you're embarking on. How beneficial would it be to the society in the long run?
Well, in the long run, you see, if you take 100 persons, 100,000 persons, and they are healthy, their ability to produce, is a healthy man that will go out to work. It's a healthy man that will go out to seek for a business intervention. It's a healthy man that will want to go out to get the things that he needs to do. And so it will help the production capacity of the state. It will help bring up that additional productivity from the people. So if it will also put, like, if somebody cannot go to hospital because he has an infection, and because of that he can spread it around the community, that distribution of ailment is also broken. So the effect is enormous to the society.
Thank you so very much, sir. If you check your time now, our time is already saying round up, round up. But then, before we go, there must be a message that you want to send across to people, especially when we're talking about the 100,000 enrollees. Sir.
Let's spread the goodness. Like my friend said, you can forgo just 2 bottles of beer and a plate of pepper soup for 2 days, and voila, 7,000 is available to help somebody receive health care for 1 year. We are calling on every person, not just the big ones. Some people can do 100, some people can do 50, some can do 1, some can do 2, and some can do 1,000 and more. But we are calling on everybody to join, because 100,000 is just a figure that we've put in. Like I said, we have about 600,000 people out there in this. That is classified among the poor of the poor. Let's reach out to these people and tell them that we care.
Thank you very much, sir. And our pidgin English woman, is there something that you would like to say?
Yeah, like my people, I always talk and say, health na wealth. Our concern, our aim, our objective, our goal. Now make access dey boku nyafu for everybody. Now more access to better healthcare. Now we dey provide for everybody.
Okay, thank you so much, Patricia Memudu. Well, it's been the program Delta State Contributory Health Scheme and You, and I've been your host, Eunice Emeyazia. Remember, something that you should take home. It's not too big to bring out 7,000 naira to save a life. 1 year, that person can access health care. It's not too big. Try what you can do to help somebody close to you. And then remember that the functioning Director General always say on this program, the assurances are there. If you have any complaint in the scheme, direct it to the Commission and they will address it immediately. Thank you so much for being part of today's episode. Next week is yet another time. Thank you so much, Dr. Biakofa, and thank you so much, Patricia Bemudu.
Thank you so much, our presenter, Eunice Emeyazia.
And bye for now.